Hey, BC here for PC Nephro. Welcome to PC Nephro, and today talking about an incredibly exciting subject, the adequacy of dialysis. All kidding aside, this night might not be the most exciting thing about nephrology. It's not acid base or electrolytes or glomerulonephritis or things like this. But if you're involved in the care, interested in the care of chronic dialysis patients, it's a very important subject. Check out, it's the next in our series, Dialysis Rounding Primer. Check out the other videos, the other articles linked to introduction overview of dialysis and monitoring of patients with acute kidney injury requiring dialysis. This is the next in the subject. So adequacy dialysis. So how do we know if a patient's getting enough dialysis? How do we prescribe this? How do we assess this? We know that chronic dialysis typically is 3 days a week, either Monday, Wednesday, Friday, Tuesday, Thursday, Saturday schedule. By how many hours? And how do we know if it's sufficient for them not to get uremic complications? So there's a couple of things. This is assessed by something called urea kinetics, which I'll get into later. But the bottom line, my opinion, what I'd like to convey in this video is that longer dialysis treatment times are better. We may not be able to measure why, but they're better, in my opinion, for the patient. And so how long should a dialysis treatment be? So the data suggests, in my opinion, that a cutoff is 4 hours. So dialysis treatments of longer than 4 hours are better than dialysis treatments of less than 4 hours. There's some links to some studies that suggested decreased mortality with treatments greater than 4 hours versus less than 4 hours. In the article linked below at BC Nephro, you can find links to those articles and check them out for yourself. But that's my opinion. Now, patients, of course, don't want to be at dialysis. Who would want to be there? They typically want shorter treatment times, and they will request a shortened treatment time. So the deal is what is enough to get by versus what should you do to have the optimum health and the optimum mortality benefit from dialysis. So what's monitored is the what they call urea kinetics, the assessment of how much urea is removed per dialysis treatment, and this is assessed by a formula called KT over V, which we'll get into the details there, but you can check it out in the article. So K is a clearance of the dialyzer, T is the time of dialysis divided by the volume of distribution of urea, which is essentially the volume of distribution of water. So this needs to be, there's a bare minimum that this needs to be that's assessed. If it's below this minimum, there may be an increased mortality. That minimum is 1.2. That's measured once a month, and what happens, that treatment is extrapolated for the rest of the month. So it is recommended that we target a higher 1.4 to make sure that we're achieving that 1.2 in the interim. A quick and dirty way, which is not quite as accurate, is something called the URR, urea reduction ratio. That's the percent urea that is decreased during a dialysis treatment, and the urea is measured pre and post dialysis in a standardized way. The minimum for that would be 65%. So this is how much you need to get by. Below that, there's clearly a higher mortality, but that, in my mind, is necessary but not sufficient. There's other things that dialysis does that we don't measure, we don't know about. There's other things we do measure that we need to pay attention to. The potassium, volume status, phosphorus, these things need to be controlled as well. If the KT over V and urea reduction ratio are good, but those other things are out of whack, that's no good. How the patient's feeling, their appetite, energy level, this should be optimized. And of course, their mortality should be optimized. So bottom line is minimum urea kinetics, target KT over V 1.4, achieve 1.2. That's necessary but not sufficient. Really encourage the patients to stay for 4 hours or longer treatments, even if those numbers are there. And tell them that, do you want to just do enough to get by, or do you want to optimize your health? Do you want to optimize your mortality benefit? This is what I talk to patients about. And check out the details at the article at bcnephro.com. Check out the links. Leave your comments or questions. either email me, brian@bcnephro.com, or leave it in the comments below. And more exciting subjects coming soon. Okay, bye.